The health of humans, animals, and the environment are inextricably linked. This interconnectedness is the foundation of the One Health concept. One Health recognizes that human health is not isolated, but rather deeply intertwined with the well-being of animals and ecosystems. It acknowledges that factors impacting one area can have cascading effects on the others. This holistic perspective is crucial for addressing complex health challenges that transcend traditional disciplinary boundaries. One Health promotes a collaborative and interdisciplinary approach to health. It encourages scientists, researchers, policymakers, and communities to work together across disciplines. This collaborative framework allows for a more comprehensive understanding of health threats and facilitates the development of effective interventions. By considering the interplay between humans, animals, and the environment, One Health provides a comprehensive framework for achieving optimal health outcomes for all. One Health has gained increasing recognition in recent years. This is largely due to the rise of zoonotic diseases, which are diseases that can be transmitted between animals and humans. The COVID-19 pandemic, for example, highlighted the interconnectedness of human, animal, and environmental health. It demonstrated the devastating consequences that can arise when this delicate balance is disrupted. The One Health approach is essential for addressing a wide range of global health challenges. These challenges include emerging infectious diseases, food safety, antimicrobial resistance, and climate change. By understanding and addressing the interconnectedness of these issues, we can develop more effective and sustainable solutions for a healthier planet. Antimicrobial resistance, or AMR, is a pressing global health threat. It occurs when bacteria, viruses, fungi, and parasites evolve to become resistant to the drugs designed to kill them. This resistance renders treatments ineffective, making infections harder to treat and increasing the risk of disease spread, severe illness, and death. AMR is a complex problem with far-reaching implications for human and animal health. It is driven by various factors, including the overuse and misuse of antibiotics in human medicine, veterinary medicine, and agriculture. When antibiotics are used excessively or inappropriately, it creates selective pressure that favors the survival and proliferation of resistant bacteria. The World Health Organization has identified AMR as one of the top 10 global health threats facing humanity. It is a significant threat to global health security, food security, and economic development. Without effective antibiotics, many standard medical procedures, such as surgeries, organ transplantation, and cancer chemotherapy, would become much riskier. Addressing the challenge of AMR requires a comprehensive and collaborative approach. This approach must involve multiple sectors, including human health, animal health, agriculture, and the environment. The One Health framework provides a vital platform for fostering this collaboration. Antibiotic use in animal agriculture is a significant contributor to the emergence and spread of antimicrobial resistance. While antibiotics are essential for treating sick animals and preventing disease outbreaks in agricultural settings, their overuse and misuse have fueled the development and transmission of resistant bacteria. This poses a serious threat to both animal and human health. Animals, particularly those raised in intensive farming systems, often receive antibiotics as a preventative measure. This practice aims to prevent infections in crowded and often unsanitary conditions. However, this widespread use of antibiotics creates an environment where resistant bacteria can thrive. These resistant bacteria can then be transmitted to humans through various pathways. Consumption of contaminated food products is a major route of transmission. When animals carrying resistant bacteria are slaughtered for meat, the bacteria can contaminate the meat products. If these products are not handled or cooked properly, the resistant bacteria can be ingested by humans, leading to infections that are difficult to treat. The environment also plays a role in the spread of resistant bacteria from animals to humans. Animal waste, often containing antibiotic residues and resistant bacteria, can contaminate soil and water sources. These contaminants can then come into contact with humans through recreational activities, such as swimming or through the consumption of contaminated crops irrigated with contaminated water. So now let's start connecting the dots between agriculture and AMR. Numerous studies have shown a correlation between antibiotic use in agriculture and the emergence of antimicrobial resistance in humans. These studies provide compelling evidence for the interconnectedness of animal health, human health, and the environment, highlighting the importance of the One Health approach in addressing AMR. For example, a study published in the journal Science found a strong association between the use of a particular class of antibiotics called cephalosporins in poultry production and the prevalence of cephalosporin-resistant bacteria in humans. The study showed that countries with higher use of these antibiotics in poultry had higher rates of human infections caused by resistant bacteria. Another study, published in the Lancet Infectious Diseases, investigated the link between fluoroquinolone use in poultry production and resistance in Campylobacter bacteria, a common cause of foodborne illness. The study demonstrated that the use of fluoroquinolones in poultry was a significant risk factor for the development of fluoroquinolone resistance in Campylobacter infections in humans. These studies, along with numerous others, demonstrate the interconnectedness of antibiotic use in animals and the emergence of AMR in humans. The findings underscore the need for responsible antibiotic use in agriculture to mitigate the spread of resistant bacteria and protect both animal and human health. Now let's evaluation the complexity of causation and the call for collaboration. While the correlations between agricultural antibiotic use and AMR in humans are clear, establishing direct causation can be complex. This complexity stems from the multifaceted nature of AMR, which involves a complex interplay of factors beyond antibiotic use in agriculture. Factors such as antibiotic use in human medicine, sanitation practices, international travel, and trade also contribute to the spread of resistant bacteria. Disentangling the individual contributions of these factors can be challenging. It requires sophisticated surveillance systems and robust research methodologies. Despite these challenges, the evidence linking agricultural antibiotic use to AMR in humans is strong enough to warrant immediate action. The One Health approach provides a valuable framework for addressing this global health threat. By fostering collaboration among experts in human health, animal health, agriculture, and the environment, we can develop and implement effective strategies to mitigate the emergence and spread of AMR. This collaborative approach should include promoting responsible antibiotic use in both human and veterinary medicine. It should also encourage the development of alternative strategies for preventing and treating infections in animals. Additionally, strengthening surveillance systems to monitor AMR trends in humans, animals, and the environment is crucial for tracking the effectiveness of interventions and guiding future actions.